this day, is very important in many respects, because number one, it helps us, to raise the awareness of the danger of, road, traffic, crashes, and also, the consequences and then the costs, because, road traffic crashes, they impose, a lot of, costs on the economy. If we are to quantify it, in monetary terms in the Gambia, it is estimated that, about, $2 billion is a cost of, road, traffic, crash, in the country. So that's, a whole lot of things. And also, the commemoration of the day also, help us, to reflect on the measures, that we can take, to prevent, road traffic, crash, from happening. Per se, it's not about, reminding, the victims, the pain, the grief, and then the suffering that they have undergone, but, for them to share their ordeals, with the people, and also for people to come up, with, measures to prevent, future occurrence. So the theme for this year's celebration, commemoration is to remember, support, and then act. Remember those who died, and then support, those who survived, and then act, for better post-crash, response. Because, post-crash, emergency post-crash response has been identified as very critical in, road safety, because, the few hours after the accident, occur is very, critical. Maybe sometimes, we see some people, who are disabled. It's maybe as a result of maybe the care they have, received when accident occur, or the way they were handled. But I'm sure, doctor will, elaborate, more on that. Yeah, but basically, that is it. Yeah.
We're talking about after accidents occur. Well, naturally, the first person that you would think of would be a doctor, because they're the next port of call. And here to help us in that area is Dr. Keba Marina, who works at the Edward Francis Small Teaching Hospital. Doctor, as someone involved in, treating victims of road crash, how important is this day to you?
For me, it's a very important day. Just like Mr. Drame has said, it's about bringing awareness to some extent, because unfortunately, if we look at the numbers, we realize that it's actually a very common thing. But most people don't think about it when you think about the big killers or the big things that cause injuries or disability. When you think about the HIV, the diabetes, the big things, TB, those ones get far more press coverage and far more money put into it. But when we look at the numbers, you see that most places, especially in our sides of the world, road traffic injuries are taking over in terms of the number of deaths and the number of disabilities that come out of it. So it's important for us to be able to see it. Sometimes when you hear things said, it doesn't register as much as when you see it. When we had the program this afternoon at the traffic lights, when some of the victims stood up and said their stories, those kind of things touch people. So we remember the ones that, as we said, the ones that we've lost, try and continue to support those who are still here, but we need to try and act to prevent further people going through the same ordeals.
We're talking about road traffic accidents taking over. I mean, a survey that was done by the UN last year revealed that the Gambia is now ranked 8. I mean, of all the countries that registered the highest number of accidents, which is really, given our size, quite worrying. But let me introduce Mr. Cisse now, who is the president of the Gambia Transport Union. Mr. Cisse, we are commemorating a very important day. Whenever there are accidents, one of those who would be involved is obvious, the drivers.
Yeah, thank you, Mr. Nyasi. This is a very important day for the transport union because if we are talking about the road accident, most of us, our money will go to commercial drivers because most of the time our drivers used to involve in the accident. That's why we are liaising with the ministry to see how to strategize to prevent our roads. because we all know as of now transport is everybody's business, especially if it's an accident for us. We be a victim. End of the day, we can pass through. Our members will can have charges from the Gambia Police Force, or end of the day they can serve the jail terms. So that's why we want to come in to see how to liaise with the authorities concerned to prevent our road so that our properties can be secured and our life will be secured. Because today we see our drivers, most of them come to be a victim. Lost their hands, some have passed away. So end of the day, they're going to come a driver, they are going to find out a job or to expecting people to help them. So if we are just out of issues, we are really thanking the government to go and to join together to see how to prevent this road traffic accident, because most of them caused by human errors.
Well, talking about preventing road accidents, let me engage the director now, Mr. Drame. As director, what do you think is responsible for these road accidents as director of planning? I'm sure you must have done surveys into what are some of the factors that are responsible.
Yeah, unfortunately in Gambia, not much research has been done as to the the causes of road accidents. But we know about the risk factors that we are talking about here. Is number one risk factor is speeding, and non seatbelt use, and then the use of drugs and alcohol. These are some of the risk factors. But when you look at the issue of road safety itself, because people are normally of the notion, like started blaming individuals. For example, when accidents occur, some people will say the police are not doing their work, or some will say National Roads Authority, the roads are very, very bad. But it's like a combination of factors. It's just like the whole system have to be safe, starting from the infrastructure, the vehicle, and the emergency response services. All those things have to be in place. And at the level of the government, what we are doing currently, because it is recommended internationally for countries that are serious in tackling their road safety problem, is to develop road safety policy and then strategy with clear targets. For example, if we know that the accidents are about, currently we are talking about on average 115, and then we set ourselves a target to have that. So at the level of the government, the roads safety policy has been embedded in the national transport policy since 2018, and with the support from the sub-Saharan transport policy program, we were also able to develop the road safety policy strategy for the Gambia 2021 to 2030. This strategy have been validated, I think, last week, sometimes last week. This strategy is well aligned with the Sustainable Development Goals. I don't know whether you are aware, for the first time now, the issue of road safety has gained global attention. Like Doctor was saying, the reason why other killer diseases people were able to succeed in combating them, because of the global attention they receive, and then the funding they receive. But unfortunately, road traffic crashes, we are talking about 1.35 million deaths annually, and per day we are talking about 3,000 deaths. Maybe, who knows, as we are speaking, maybe someone is dying on the road.
Sure.
But unfortunately, the issue of road crash did not receive that much global attention. So we aligned our strategy with the Sustainable Development Goal, and also the National Development Plan, obviously, and the targets were aligned with the voluntary targets that were set by the UN. And in the strategy, we clearly identify the critical issues, the problems, and we identify 8 strategic direction, which we believe if we pursue, we will be able to tackle, the problem of, road safety in the country. This strategic direction, number one, have to do with the leadership and then the coordination. The countries need to have a lead agency. For example, currently what is happening, there is no institution per se who is responsible, when accidents, occur. So the Ministry of Transport, we are assuming, that responsibility. We are the ones now, coordinating. That's why at our level, we have the Road Safety Committee, which is chaired, by the Minister of, Transport himself, and then the working group, which composed of, technicians, from different walks of life. And the next strategic direction that we want to look at is the issue of, capacity building. Because if you look at the players, for example, if you go to the medical field, we don't have adequate, qualified personnel, to handle these road crash victims. If you go to engineering, there is what you call these road safety inspections and audits. Our people are not doing it because maybe the capacities are not built for them to be able to do that. And if you go to the police also, in terms of capacity building, there are a lot of equipment that the police needs, but they are not having it. For example, a mere breathalyzer, the police they don't have it. If you talk of this thing, the speeding, they don't have a speed gun. It's just they just use their conscience to determine whether someone is speeding or not. So we definitely need to build the capacity of our people in different areas. And also this issue of enforcement also is something that we want to focus on as a strategic area. And then this issue of sensitization also, because research has shown that about 95% of road crashes are caused by human error. So there is a need to sensitize the people about the danger they are exposing themselves to. And the other strategic area that we want to look on is infrastructure improvement, focusing on the pedestrians, because it's evident out there most of our roads, they don't just have facilities for vulnerable road users. When we say vulnerable road users,
and even vendors as well.
Yeah, we mean the pedestrians, the cyclists, and then the motorcycle riders,
which causes traffic congestion. Leads to accidents.
Yeah, definitely. Our plans now have to focus on how we will provide facilities for these classes of road users, and also regulatory reforms. Because when you look at our laws, some of our laws are not just adequate. Some are outdated. Some are just outdated. For example, if you look at the issue of use of alcohol whilst driving, currently our laws, we don't have any limit for blood alcohol limit
testing.
So how are you going to prosecute someone? So there are a whole lot of things that we should focus on as a country if we are really serious about our, improving our road safety condition.
Let me engage Doctor now. One of the key highlights I picked from his intervention is the issue of emergency response, and also, limited capacities we have for the hospitals as well. What are we not doing right in that area?
I would say, I think we start by saying a lot. I think, as we've said, there's a lot of things that are lacking. When we talk about an emergency response or response to a crash, in the medical circles, we talk about the golden hour, which is something that's the time that you really have to save the person's life. If you look at most of the crashes that happen here, what happens when someone has an accident? They're lying at the side of the road, someone finds them. They usually end up having to find transport, maybe a taxi. They carry them, people who are not trained will lift them up, put them in a taxi and rush them. They then go to the nearest health center maybe. Then they get transferred to the nearest hospital before they eventually come to Edward Francis, maybe 5-6 hours down the line. That in itself, we get a lot of deaths on the way, even before they arrive at us. So emergency response, the first response is very important. And as a country, we're lacking that as a whole. There's no single number that you can call when you have an accident and say, this accident has happened, ambulance needs to go there. The Red Cross have started one, but of course that takes time, and we need more. Just having 2 ambulances alone is not going to cover everything. So that is one area that I think definitely needs to be focused on. That's the first part of the post-crash. Second part is when they arrive at the hospital, what can we do for them? And even there, the capacity can be increased. You know, the amount of doctors that are available, trained in, specialized in dealing with these trauma cases, the equipment that is there to enable us to save these lives. There's a lot of those that we can still do better. We're improving to some extent, but we could still do better to save these lives. And then you have to think about the ones that are not at risk of dying, because not everybody dies. But we have to think about disability. That's a very large amount. If you think about the crashes that happen with the cars overloading, a single crash can involve 20 people. If it's 2 gele-geles, we're talking 30, 40 people. You know, a lot of those people, their lives will change to some extent with the injuries that they have, fractures and so on. And these need to be able to be managed adequately so that these people can go on and continue their lives and be productive members of society.
Let me engage Mr. Cisse now. At your level, at the level of the transport union, you've heard from Mr. Drame during his intervention. He highlighted the issue of people getting drunk and driving, you know. How about drivers also respecting traffic rules, observing traffic rules? Do you have such complaints as well? I'm sure you must be having engagements with the police from time to time.
Yeah, we have a lot of complaints about this, but how many drivers know these road signs? You can say the average of drivers don't know road signs. So drivers who is driving a vehicle, motor vehicle, don't know road signs, end of the day we are supposed of accident from that person. Because they don't know where to stop and where to move. So look at our residence zones, like schools and hospitals, how the drivers are behaving there. So that's why Mr. Drame said we need to do a lot of things like sensitization or capacity building, especially our transport side, because most of people are driving, we can say they are driving a vehicle, but they are not competent, they are not qualified to drive those vehicles. Because they are through the protocol to get the license. So I think that is more factor we need to deal with it. Because today, we all know Gambia, if you need driver license, you sit at home, driving license, you meet at home. So end of the day, what is going to happen?
That is an important point. The issue of enforcement, the issue of ensuring that whoever, is to drive on our roads is competent enough, is qualified enough. Mr. Drame, I think it would have been good if at least we have a representative from the police here on this platform. Unfortunately, we're done, but at your level, are you in any way engaging the police as well on this? It's very, very important. I know, the traffic infrastructure here is somewhat deficient, but again, attitudinal change is very important in terms of enforcement. Who deserves to get airline seen? The person has to be qualified, tested several times, and confirmed that you can drive. This is an important point that Mr. Cisse has touched on.
Yeah, I think, we have, identified, a lot of, deficiencies in the whole, system. And if we definitely want to be, serious, with our enforcement, it's like laws have to be, in place. But, currently, if you look at the traffic laws and regulations, like I said, it's much to be, desired. That's why, at our level, currently we are working with, all the relevant, stakeholders to have a comprehensive, review of the traffic laws and, regulations in the country, because there's the time, we will try to address the procedure for issuing these licenses, and also even the operations of the driving schools, and many more. Because currently, some of the laws, for example, if you look at the fines, they are as low as $20. What?
Seriously.
So what is that? It doesn't make sense. So that's why, as part of our strategic, directions. We are seeing safety, targeted, regulatory, reform. Because, we will look at, areas, where we think, they need to be, reformed, and then we reform them, and then put a system in terms of, regulatory framework, in place to enable, the police, to do their enforcement, effectively. I highlighted, the issue of some of the equipment, the necessary equipment, for example, if I am overspeeding, like 120 an hour, and a policeman, is just standing on the road, and then he just told me, like, you are speeding, but what evidence can he produce that, I am, speeding? Now, if you look at, for example, drunk driving, how do they determine, like, someone, is drunk?
Sure.
So it's like, there are a whole lot of, issues, that need to be addressed. That's why I think, this coming up of this, road safety, strategy cannot come at a better time. And I'm very much optimistic that the implementation of, this, strategy will go a long way in improving our road safety situation in the country.
Mr. Sise, before I come back to Doctor, earlier you did raise a very salient point, the issue of drivers also not, many of them not understanding traffic rules. Don't you think we need to have more traffic signs, especially along our highways?
Yeah, we need to have, I think, any new routes, we used to see the road signs there, but what most important, end of the day, maybe 1 year or 2 years, they all demise. So what most important as of now for me, as a driver, if the road sign is not there, your qualification can determine what you can do. If you are competent, you are living, you are entering the village or the town, you all know the per kilometers 30 or 25. If you are driving a 60 or 80, end of the day, what do I expect? If someone cross you or any emergency, end of the day, you hit the person. So I think our attitude needs to be changed. That's most important. What Mr. Dami said, the capacity building and assessment campaign. No, I think last year, 2018, we did this with the Gambia Police Force. We countrywide to 2019 also, 2020 due to COVID. But we are planning with the Road Safety Committee to go around to meet the drivers, to know their concern with the police, to discuss with them. But I think today, this commemoration day, most of the drivers feel sad because this, victims start explaining their story. We all know each other we study. So today, the decision we have tomorrow can be me. So I think it's a better time to start as a country to come together to see how to, prevent of better future.
So at the level of the union, what do you think should be done to, prevent or minimize road traffic accidents?
Yeah, what do you think? I think is what to have a national transport policy, road service policy, and to have better laws, because law is good to govern people. Like for example, if I commit a crime, you take me to court, I pay $100. That's nothing to me. Yeah. So but my recommendation is going to be you need to have another department who used to introduce the laws, not the police. Police introduce police enforcement. Because you're going to be a judge and be a jury at the same time. So you have some lapses. For me, that's my recommendation. We need to have like Ministry of Transport or whatsoever, introduce the police enforcement. End of the day, you can have an oversight body who, accountability and just transparency. But if I'm the one who is driving license, you enforce it. End of the day, you have some lapse. End of the day, people don't understand that. For us, as a transport union, we want all time to be professional because this is our optimism. End of the day, we all know our people are doing good. But every day, every month, we are attending accidents. We go to accidents, funerals. End of the day, you end of the day, use your mind because it's not easy at all for us.
So Doctor, earlier, you also did highlight some of the abilities we have within the system, especially in your area, as health professionals, in dealing with these patients, in trying to save lives. What must we do now, what must we do right to ensure that whenever we have such cases, at least the risk of losing victims would be very, very low?
So part of what it needs is foresight, because sometimes when you're very far behind, you don't expect things to change overnight. We're not going to next year suddenly become very good at doing things. What we need to do is plan. If we know that, we have maybe 5 major health centers around the country, each of those 5 should be equipped enough that they can deal with an accident. So you don't have to go to Bansang and come to Banjul. You can be treated in Bansang. that needs a doctor, that needs nurses, that needs paramedics. It needs equipment. So if we set a plan and say, in 5 years, this is what this is where we want to be, then we can work towards that. And I think that's what we need. And the strategy that has been developed in our meetings. A lot of things have been discussed, and there's very good things on paper, but of course we need to be able to implement them and make sure that these things happen. And some of the targets is about the length of time that the person from the crash to first seeing a doctor, and so all those targets are within the strategy. It's just that we need to be able to ensure that we actually implement them and are able to get to where we want to be.
Our road traffic accident statistics are quite worrying, and almost every severe case, is brought to your hospital. On average, let's say maybe in a week or in a month, how many cases do you have, or how often do you have such cases?
It's very frequent. It can vary from the time of the year, but even just looking at November to date, where we are, there were, I believe, at least 6 or 7 deaths from road traffic accidents, and at least 19 severely injured, and we're just halfway through the month. That's just for November that's gone. There's been a study that was done in Buiam over last year, where they had 32 deaths over the space of 1 year, and I think it was over 100 serious injuries. So if you extrapolate that to all the other major health centers, or rather major hospitals, it's a problem. So even the statistics that we say are worrying, I would say are underreported, because we're not collecting enough. So if we actually got the real statistics, we should be even more concerned.
Quite worrying there. Be reminded you're watching this live broadcast coming to you from QTV, and it is in commemoration of the Road Traffic Accident or Victims Day, Remembrance Day. And here with me is Mr. Esa Drame, the Director of Planning at the Ministry of Works, Transport and Infrastructure. And to my immediate left is Dr. Keba Marena from the Edward Francis Moore Teaching Hospital. And next to Doctor is Mr. Omar Sise, who is the President of the Gambia Transport Union. Mr. Drame, recently we've seen driving schools. People establishing driving schools. There was one recently that I watched on the news, who collaborated with the police to test some of the people that they were training at their school, which is a good move. But again, how do we ensure, especially, I remember you did highlight very strongly the issue of having a very good policy and ensuring that all these laws are enforced. How are you working? Is the ministry aware of the existence of some of these driving schools? And how are you working in ensuring that, they are very much effective?
Yeah, thank you very much. This is something that, we are very much, aware, and we try to partly answer it in our policy document, which was adopted sometime in 2008. For us, what we're trying to do is like to separate this, policy, regulation, and then the operation. Yeah. Because normally in other countries, what they normally do, it's like they have what you call, Department of, Transport. Department of Transport mostly, deal with, the regulation of the sector in general. But Gambia, maybe due to one reason or the other, how we find ourselves, and then we need to move away from that, because the policy is very much clear on that, because some of the functions are not performed by any institution. For example, currently, when you come to the regulation of these driving schools, no institutions can tell you that they are actually doing the job.
There's a significant lapse.
Yeah, and then if you look at this issue of vehicle testing, the police are doing it, but are they doing it right? We all know that we all have our vehicles. You just do visual inspection, and then you are issued with a roadworthiness certificate. Is that the way it should be done? No.
Yeah.
Are the police, the right institution, to do that? That is something that, well, Umar just mentioned something, very critical. It's like you cannot be a judge and then the jury.
Yeah.
The policy is emphasizing like the police to be focused on enforcement. So these other issues like the testing and then the regulation of the issuing of, license and then the regulation of the driving schools to be handled by a different entity. I think when we have, those system in place and we lay down, procedures, I'm sure, we will be able to see some significant, improvement. But, sometimes, if people are used to a system, you cannot just change it overnight. It's, gradual. Because at the level of the ministry currently, we are working on establishing the Department of, Transport. And as time goes on, they will start, handling, some of the things, that I am just, highlighting. Obviously, it is, for example, like the issue of, vehicle testing that could easily be handled by a private sector, whilst, the Department of Transport, regulate, their activities. The issue of, license, someone have to, regulate them. For example, if the police are the ones, issuing the license and they are the ones, enforcing it. If there are lapses there, who is there to regulate that?
That's true.
So those are the kind of things, that we definitely need to, address if we are really serious about improving our road safety situation in the country.
Doctor, would you like to add something to that?
I think that most of it has been said, but I think the reason that I say this day is important is letting people, the awareness, because part of it has to come from within. We all live here and get into your car. Whether it's you're a young person learning to drive, you have to want to be safe, and you have to know that an accident or bad judgment on your part can lead to serious injury to someone else or to yourself.
Sure. And
you then have to take the steps. It's very easy to sit at home and pay and get a license and feel that you can drive.
Sure.
But you should yourself want to be a good driver. You should want to go out and go to a driving school and learn how to do things properly. Because then when you get into trouble on the road, you'll be able to deal with it. It's not just getting in the car, pressing the accelerator and going. There's a lot more to driving than that. You need to know the road signs. Most of the people you go around will not know the road signs. If you don't know the road signs, how will you know when it's indicating that there's a danger? So there's a lot of things that have to come from within. People have to want to change. Because unless that comes, then no one is going to change. Even if you introduce a good licensing, people will try and find their way around it. They want the easy way instead of thinking about the consequences. And I think this helps us to see some of the consequences. If people see the ordeal that people who have had accidents go through, the livelihoods that are lost, the earnings that are lost, the families that are destroyed, maybe it will make them change when they get on the road.
Omar, Mr. Drame did highlight the issue of drunk driving, the issue of drivers not respecting the traffic rules, not wearing their seat belts. But how about the issue of overloading and, having faulty cars as well?
Yeah, overloading and faulty cars, I think still is under control of the Gambia Police Force, because the police are, launching the vehicles. The vehicle carry this capacity. Police have that mandate. So if police allow the vehicle to carry 40 people, how can I deny it?
Is the union engaging the drivers on this?
Yeah. Even last week or last 2 weeks, if I got my breakers survey, we have discussed with the Gambia Police Force through their police management to collaborate, to see how to work together to highlight some of issues. Because for us, we have a concern. We see some form of vehicle at the garage. We all know the vehicle is not roadworthy to drive. But drivers have all necessary documents. How can it deny So you see. So, but we listen to the police to discuss, because this is everybody's business. Because we are all victims the other way around.
Yeah.
So they need to come together as a team to look at these challenges, to see how to modify it or how to make some recommendations. I think what the ministry is doing now is very important, to bring stakeholders together, to sit and discuss. Because today road safety is everybody's business. So we all know our drivers. Most of drivers are driving the vehicle are not roadworthy, or drivers who interference, and so on and so forth. But if we're all serious, I think we can stop it. So that's why to bring stakeholders to discuss, to build our capacity, to know what's happening. So I think end of the day, we can, even after this, we have a meeting with our national committee on this subject matter. Because we want to know how many people, any region, how many drivers have been in accidents. What is the cause of the accident? Most of the accident is careless, reckless, and overspeeding.
Absolutely.
So this is not acceptable. So how can you drive a vehicle just like that? Understand? If people start complaining, start mind a business and so on and so forth, or you are driving a reckless driving, your vehicle is not having headlights, no brake light, you want to drive. So I think that's what we can challenge. We can address it if we are serious to do it. But I think together we can do it. This is the better way to solve these problems.
Indeed, together we can do it. I'm afraid we might now switch over to the local language for the benefit of our local audience as well. So they will also be part of this discussion. Let me allow Mr. Drame to, introduce the topic of discussion and, of course, go on to also at least give a brief, highlight of some of the things that have been said here in Mandinka for the benefit of our Mandinka audience.
Okay, Asumani, baraka bake. Comme ñinenka men being juraro menke men ikafa ko World Remembrance Day of Road Crash Victims. Walem prung hakilo lebula men ya lon ko imantoro soto road accident la koto. Being a juraro lekeno. Ning lungo nyinga jurata nung sanji muaning feng komantano. Bar Gambia ala natake bilam dum flotin be men jurala. Yin juraro la nafa momenti amanke komen ka molo hakilo bulandi comme ye bata kool men soto ani ye ni kuyal menu soto comme fo la mol le fata bang fo ilan jurtale bang bari comme kayitandi la ko ñing amanke al damala koti mu mobela kolete mobela sulolete ani fana kayitandi mol la ko ñing kome atinna ñune ñi mantoro soto comme kula mu me alon ko nyanna serious la akolale ani fana comme sem fantankandi no silo kan nyame fana puruka molo karandi wala so wala mu akola kumayati so wala nantol kabrimbe nyum jurala ngamolu bondi nang dulal beleto fo basse meni alon ko nana mantora cool soto accident la karola nata ni commémorer ñola after nata nga fengol fanal ni dila même domor fengol ani nga kodo fana dila pour que mako pour que ila bilol pour que wol fanal jono kabrum botaje fanan tata hospital lo fanatule nata taraje fana mo jamal fanal be je men yalan ko science be mantorare nata nga kodo fana di wala pour ila bilol pour se fanal jono comme dal lafta me yitande la molla comme accident wala ko comme tol be nsekeno motile me yalan ko zemanto rosoto malaji so walatina ko kumayata tol be le responsibility soto kaje ko ngam fan tankandi ngam modol fanal tankandi accident.
Okay.
Yeah.
Abaraka bake be mulle kan ko tanke but okay ma dalal ke di Mr. Cissé ngam moy president bu Gambia Transport Union momi tamit musani ci kaddu ndax yene ngi mëna bokk ci waxtaan bi.
Ya jërëjëf Asumana comme nu directeur waxee tey bis bu am solo la ndax comme nu ko waxee ñu fàttaleku ñoo xam ne dañ jot a ñàkk si seen bakkan am ñoo xam ne da nga am ci gàllankoor ak lan la war a def ndax tey soo demoon ground bi nga xool koo xam ne xale bu ndaw la mu ñàkk ci ram ku mel ni loxo o tànk o mun ta def lu mu doon def kon loolu suba mën na maa dal mën na dal keneen kon yaakaar naa dafa jar pour ñu ñëw ñu fagaru pour loolu bu ñu dal mën naa ñàkk a am soo fekkee ne pare na pour def ko comme ni ñu la waxee soo ne accident ñu bari seen xel dina dem su ñun mooy ñun commercial drivers ndax ñun suñu accident du tuuti ndax moto bi lu muy jël si nit daf lay bari su daanoo rek leneen mën naa su nature of the vehicle sax moo sa accident la mën naa ko waxee noonu moo tax boo jël 40 people su moto bi daanoo foofu leneen lu nekk mën na faa xew kon moo tax bu ministre yi hôtel yi ñun ñu sawar si ndax ñun su accident mais dañ si dee involve lu bari driver dina nekk victime su gaañul sax moom victime la ndax moo doon daal moo jël responsabilité bi alal bu fi yàqu suñu alal la mu ñu si gaañu ñu si loolu suñu mbokk lañ kon yaakaar na ñun lu ku woote pour ñu fagaru loolu ñu ñoo si war a jiitu moo tax ñu talale sa loxo pour ñu yëpp ñu bokk ñu xalaat mbir bi lu ko waral ak lan la war a dem sàmm because soo seetee ñu ne accident yu bari yu fi xew yu bari nit suñ jikko moo tax muy am kon loo xam ne mën naa ñàkk a am la kon suñ paree à ce country mën naa ñàkk a am because soo fee moto dafa war a daw like for example 25 kilometers per hour nga ba ko war dawal moo leen daan you expect to have an accident moto boo xam ne histoire road yaa ngi ko dawal pare nga pour am accident ku xam ne mënu oto bu ko dawal oto pare naa am accident soo yii la war a fànk pour buñ ko am du yaakaar naa ku nekk bu nga sauver sa life kon yaakaar naa alal nee na bal fekkee su wala nee na wala white man si health is wealth ku wér rek mooy liggéey bal soo fekkee ne ñu doon dawal nii tey ñoom na am na gàllankoor suñu xamoon loolu dinañ dal duñ jëla ñun balaa fii ñëw moto moo ñu fi indi li su ñëw moto moo ñu yóbbu kon yaakaar ñun ñëpp war nañoo bokka ñu xalaat biir muy kuy dox tànka kuy dawal oto muy police bi muy ministre bi muy hôpital bi ñu bokk xalaat biir bi du yaakaar suñu sérieux comme yeneen dëkk ku mel ni Sweden si may break saaf mi aar na seen tali bi at bi ñu ne waa ay ñaari ñetti accident ay nit lañ comme ñun nu mu ko defee mën na ko defee noonu wala yaakaar naa ministre loolu bu ñu jël nii soo sofee déggu nañ ci rek continué nañ ci rek ñun ñëpp yaakaar naa ay fi ISE comme dinañ gis ci gis yu bëri si tali bi
waaw dinaa ñëwaat si monsieur Dramé waaye ma dugal docteur rek moom itamit mu sànni ci kàddu ndax moom mu ngi liggéey ci lopitaan bi gën a mag ci réew mi lay wax te li ëpp ci kees yi nga xam ne moo dee xew ci réew mi si accident si ñoom la dee mujjee docteur ma bàyyi la nga sànni ci kàddu.
ok naa try si wolof tuuti.
waaw da laa ko olof yi sarawule rek.
so lu ñu doon wax tamit suñ si boori docteur yi ñun luñ dee wax mooy post crash action bi. loolu mooy lu dee xew after accident bi am because of course the best thing mooy pour accident bi bu mu am waaye su accident amee foog ñu try tamit ñu dimbale nit yi ñu involve si accident bi pour buñ lose seen life o su fekkee ne dañ am injury pour bu mu graaw so loolu lañ doon wax fii ne daf dee important su accident amee the first 1 hour bi dafa very important so foog ñu am système si country bi ñu wax emergency response system ñu mun a dem si fu accident bi am ñu dimbale leen foofu yóbbu leen si lopitaan bu baax lopitaan boobu tamit suñ fa àggee foog ñu am fa docteur ñu mun a ñu leen mun a treat docteur yooyu tamit foog ñu am equipment pour treat ñooñu tamit parce que léegi di nga gis ne soo amee accident anywhere si biir Gambia su fekkee ne serious na Banjul ngay ñëw so di nga gis ne soo jógee Bansang balaa nga àgga Banjul mun naa mut maybe 4 hours 6 hours sometimes daf dee ëppa loolu
mun na see ñàkk ba kenn
waaw mun na see ñàkk ba kenn si time boobu so that post crash response boobu dafa important trop pour ñu seet loolu seet naka la ñoo dimbalee nit yi suñ amee accident ba pare pour bu mu leen géten noonu bu baax
ok monsieur Dramé ya foning anglais kan wala ko accident ka siya bakele ntolla jang anung ya fole fana kol melkatin na accident ka siya na silol kan wala hani bin konyol kono teng isa fono ko tan kere ni man ka ko la pour mbari ngom yalan ko ibe jibero la e français ida setara dia kacañin kono
comme nga fa ñamen accident ka siya banko kan bakel because ni ajube sayin nka men fo ne ba haymala sango sang safo no mo keme mo tanne lulu wala ka fa accident la Gambia jang and ne ajube fana moment tata accident moment tata fo keme sey anin tankonont wa accident wala ka ke menu fata wala bar menu ka barama wol fanal siat baramo dol be je ne ajube dol wol ika si wil ke yalla ka wol bi ka tamano ko tank so dol be je baramo dol be je le ka sotole afte kata yena faje so ne ajube nyin accident jamal beje men ya lon ko ka wala ka a cause wala komen ka moto bori nyame speed nyin ka moto bori menna anen dol beje ka dolo men sira fengol meno ma anin dol beje fana seat belt ibika dum comme belto nyin men ka taramoto ko no ibika dum because belto nyin na kumaya wala because accident dol beje wal comme ka taki moto ko no nyame wala ka tin na ka fa because ning seat belto nyin dum ning accident nyin keta maybe be kidala nyame nyato belto nyin ake tanka wala ba ne aja nim belto tela nin accident keta ni tata ikungota femma nin wata fendo ma nin alame manta ben wo kati nale accident aka jawyandile so ntol man sakunda nga nyina je wala jube comme nga mulbe samana karakilinna fanna kilinna pour nga jube be nyin ko mba kelala nyame because ne ya jube amanke fanna kilinti transport karo bejel but doctor e même foten ning accident keta fa apparaître emergency response comme kata mol pour que treat o karo fana ne ya jube fana be ministry of health ne nata jube police ol fana li tol fana li fonko soto jela karo soto jela be menke no so walatin na tol nga jube nyame pour be mbulo la nyoka pour nyin accident ñun ka men banko kantem pour sa talano
na wato man jam fako teng boden nga Mr. Chef Nambula asa komodo la fajenen sur wa kan wala den after sana programme ñing conclude but Mr. Chef won nga fi ci angale ne bokk na ci li nga xamantene mo nekk di waral accident yi moy ñi dawal te na munuñ wala sax ci niñ amé sen len sen jaaru yoon wala understanding traffic rules yu demee noonu yéen mi nga xamante ne nekk si union bi lan ngeen bàyyi xel ci loolu ak naka ngeen nekk di engagé driver pour gis ne loolu mu nekk loo xam ne lu ñoo mën a suñ ko mënta génne saa mu nekk lu ñoo mën a wàññi.
waaw jërëjëf loolu observe nañ ko ndax ñu bari ñu ngi dawal moto tey xamul lan moo road signs mooy ne lu ñoo def si kaw tali bi xamul lan lay firnde lan lu tax ñu ko fay def tali bi bind ñu fay def that white lines yi xamul lan mooy njëriñ bi loolu yëpp def day wax si kaw def laa waxal li nga war a def bal ñu bari xamuñ ko moo la kon moom dañoo dawal oto rek ñooy sax ñuy dawal moto sax pare na naka qualified dem pour dawal moto yooyu ade qualified pour ñu nekk driver yooyu comme like 14 passenger or 25 passenger or truck driver or whatsoever lancé bu ñoo am because soo seetee la am lancé bi ci loi nu nga ko waxee Gambia est-ce que mu ngi demee noonu because you know da nga war a jàng moto for 9 months pour nga mën a jàng moto du li yëpp def ko war a yëg moo ne da war a jël di laal la lancé 3 times so est-ce que ñu ngi follow because ñun ñëpp d'accord nañ fii tey da ngay toog
laal nga fu important nga war a jàng moto 9 months monsieur Dramé waxoon na ko fi ne even school yi jàngal nit ñi nu ñoo dawalee sax naam ne rafetlu nañ ko waaye nekkuñ tamit amuñ ñu leen nekk di bàyyi xel ñu leen a monitor daal te yaa ngi wax 9 months waaye gis naa ne even schools yooyu sax dañ laa jàngal si 2 weeks rek ñu jox la certificate
yaa ñu yëpp gis nañ ko dañoo war a kaay soo jàngee 2 weeks naa jox lancine ba lu nu nga ko waxee soo jànga moto programme lancine new applicants da war a jàng moto 9 months mooy da war a jël la lancine for 3 months su jeexee nga dem jàll another 3 months su jeexee nga jàll another 3 months nga soog a dem testing pour soo ko laa test ba loolu kan ma ko fi def amul kon ñu pare wuñ yaakaar naa lii la war lu ma gën a bëgg mooy kon nu ma ko waxee mooy man d'accord naa police ñoo war a enforcer loo bal mun loo defar loi nga koy enforce su miste erreur am fa kan moo ko war a firnde man dama gom ne dafa am institution bu war a am ku war a joxe kayit yi police enforce ko soo fee di ki def lu wax police taxaw ñu ne lii lu mu def baaxul bi nekko du ñu ngi joxe loxo police bal bokkal na li ko waral because ñun ñi xam ne ñoo am lancine da nga gis ni que sa kaw tali bi xam nga ne kii mënut ba su la laajee mu jël lancine jox la ko
I'm afraid foofu lañ ko emale dafa mel ni loolu tamit la Mr. Dramé doon wax ci gannaaw unfortunately we've come to the end of the show but I'll allow Doctor to say his final words and then we would all do the same.
Thank you. I think what I would really like for people to remember is that this is a serious problem that we have. As we've said, if you look at tuberculosis, AIDS, HIV, and malaria. Road traffic accidents kill more people. And we have to remember also, it's not just the ones that die, there's ones that have serious injury and disability coming from that. So it's a very serious problem, and we need to take it as seriously as we do all the other things. You buy mosquito net for malaria, you do things to avoid HIV, and so on and so forth. So you have to look at road traffic accidents as the same thing. So that's my ending.
All right, we have just a minute to go.